So here you can see there is a library. There's brain injury variability library, there's cranial ultrasound library, and there is mastoid view. So in the cranial ultrasound, you can see all kind of cases, brain malformation, aqueductal stenosis, benign cyst, calcification, etc. And I would just show you an example of the normal head ultrasound and grade 1 IVH to show you how it works. You can also upload your own cases and the software will recognize the planes of the images and will add it to the library automatically. So let's start with the normal case. So it's a normal grade 2. You click on it and here it tells you that the probe and the doll are connected. So you wait a little bit until the case loaded. And the minute you see it, you put your probe at the anterior fontanelle and suddenly the image disappears. So you have to reset the image. And from here, you can go anterior and it's pretty much as if you are performing an actual ultrasound. And on the left corner here, there's a 3D representation of what you are doing. And you can adjust the probe location if it's off. And then from here you can look at the anatomy, the frontal lobe and the anterior horn of the lateral ventricles, and then you go to see posteriorly, you see the cavum septum pellucidum, the temporal lobes start to show up, and the genu of the corpus callosum, and then you keep going, the midbrain and the cerebellum will show up, the sylvian fissure, the starting of the starting of the choroid plexuses, and then you go all the way until you see both of the choroid plexuses and the body of the lateral ventricles. And you keep going until you lose the ventricles, and then you come back to your starting point, and that's where you turn the probe 90 degree with the pointer to the front of the baby. And this is your midline. So midline, you see the whole corpus callosum, the vermis, the fourth ventricle, the pons. And from there you go parasagittal. So this is one side, and you can see the head of the caudate, the thalamus and the caudothalamic notch. Here's the choroid plexus. You keep going until you lose the ventricles, and that's your watershed area. And then you come to the other side, other parasagittal, and again caudothalamic notch is clear, and here is the choroid plexus. Keep going until you lose the ventricles, and you can see my hand in the video and how it moves and slices through the brain. So I'll choose another case. Let's go to grade 1 IVH, grade 1 IVH case 2, and then wait until the image loads, and then from this is grade 2, sorry, grade 1. And from here, you go anterior, and then you go posterior, and you see the grade 1 IVH on the right. And you keep going until you lose the ventricles. And then you come back and you turn the probe 90 degrees. This is our midline. And then from there I go sideways and you see the grade 1 IVH and in the caudothalamic notch. This is the choroid plexus. There is no blood in the ventricles. Usually there will be some blood in the occipital horn if it's grade 1 IV, grade 2 IVH. And this is the other side, and the caudothalamic notch is clear. Here's your choroid plexus. So there's no IVH on the other side. You keep going until you lose the ventricles. Now I also want to show you the MRI simulator. So this is the MRI grade 3. It put for you side by side the MRI and the head ultrasound. You can see how they are slicing together. And then the sagittal. There is the same case with the head ultrasound and MRI side by side, just to for comparison. It's not perfect slicing, but it helps for comparison. And then finally, I want to show you the ventricular measurement. So you go grade 3. So when you identify the area that you think it's standard or appropriate for measurement, you can pause your probe. And then you basically don't need the probe. You can put it down. And from here, you can click on the measurement and then this line, and you go to measure the ventricular index, for example, from outmost to midline. So that would be your ventricular index, give you measurement, and then anterior horn width. Then you click one more, gives you the measurement, and then also you can measure the frontal and temporal horn ratio. So this is how you do the measurement function. You can clear it all and then go to the probe and start the probe again. So that's basically it. And there is a tab for quizzes and teaching modules as well.